All right. Well, good evening, everyone. Thank you so much for being here.
Thanks, you're welcome.
Just 1 second. Okay. Thank you for joining this evening. I am Yarelix Estrada from the New York City Department of Health and Mental Hygiene, and we're co-hosting with the Endangered Language Alliance for this evening's community conversation on COVID-19 vaccines. Do you want to interpret, Ibrahima?
But no, I need ma, I need da ebenike, neto Ibrahima Traore, kabo Mande, la Guinée, Mali, Côte d'Ivoire. Anye be fola bi, kana tre anabi badon lo, anya fola ma ko COVID-19, ainike nalila bi, kana badola me.
This webinar is part of a series of webinars with many community interpreters for a variety of indigenous languages.
Anyok mam nani bi, an klinte, ani jamana siama, wala ani jama siama, ani kan siama neketani kela nyonfe. Andu ya ni kela, ani de kurumi ya kela otole ko Indigenous Language Alliance. Ba ani wele ni kela nyonfe, mundo, kan siama ne frato nyokon kan, kani malame, na kudu bele ya kusong. Odo aini ke la men nabi.
This evening, we will have live interpretation to Mande, and this is our final community conversation for this series.
Ba nabi badoni keto biguran na Mandinka nekan. Andu beka lo Mandinka ye furuba kanedi. Furuba kanya joma. Faida Afrique de l'Ouest be Mandinka ne fola. Wole kosan anye ni kala Mandinka lo. Sabe anyalong kamen kalo nyama kumie. Koni bia alabanedi. Ambrasian folo ke lokun temeni wala lokun jan temeni. Fla labanete. Ubuluma anya kela Mandinka berero. Kan tan nani anya fola mema kambulun tan nani. Aketo lo sai be alame. Akana fa mosiko.
We are excited to bring you all together to discuss the critical issue of the COVID-19 vaccines.
Anye ansewale ne fala andu sukaslene munkoson COVID-19 ni abragbele ya ambema. Bari andu su sewale rojon. Anye selaka anyafo jamai. Afla ma communication kala se bema. Uro ansewale urola. Kona andu sukasle ba ansamflale ni. Be konoro fulim beslani bebranyani de la barabrasa de dimba baratunu ro ansewale ne kanina sebe mabi sabe name sebe yarela ba tulunkunte sebeli kubali. Okay.
I know that we all have a lot of questions, and hopefully we will have the opportunity to speak to many of your concerns today.
Ando finance kirea amana bansanka kumadi analenka baduli baromi fa aibetra roli mombo tuluma la yetraro ni ka kememolo ko question anye yini kali ke anya fala mango yini kali anda akaya yini kali kuna friendi ma anya fala ko ajabi ando fana kuna friendi ma ni ka yini ka ande anjija ka ijabi akumare ya yini kala bo mo sikana slang kunte yini kali kala mo sikana maloya kunte yini kali kala mo sikana kondofili fosi taro ni ka yini kali ke andi jabi ay sabare ay yini kali ke. Okay.
I would like to introduce you to our Mande interpreter and community leader, Ibrahima Traore. He will introduce himself in English and in his native language, Mande.
Hello, my name is Ibrahima Traore, and I speak Mandingo language, which is very, like as you all know, is 14 different dialects called Manding. It's spoken in Mali, in Ivory Coast, in Burkina Faso, in Gambia, and partially in Senegal. So what I'm speaking right now, the language I'm speaking now is more like English being spoken in Jamaica, in Trinidad, England, in Australia. So basically, the language I'm speaking right now, everybody should be able to understand as long as you are from Mande area. Or same thing, if you have any part you don't understand, not the subject, but the subject COVID-19, you ask us and we will be able, and a few people are here, plus our host, and we'll be able to answer your question. Please don't be shy, raise your hand, and be a part of this conversation because it's very, very important. Okay.
Thank you. Do you want to interpret that into Mande?
Badenu, anyukuma min fala ni, anya fala Mandin candido, Mandin furubakan, ando be kalon, Mandin furubakan, kantan ani nani ne. Kantan nani wo, jula wale do, koya wale do, Mandin ko kanya do, Maninka kanya do, wujine kankanya do. Wele yofo, ambe diren kankelem na wale wadi. Wodo yafo ko angle kanya yamma. Jamaican ya fala nyakle maori, anglais ya fala nyakle ma, Australien ya fala nyakle ma, we be nyon ya ila ma, nyamma, anfana nyon ya ila tene, ana kando. Do baro ninketo, kambulu tan nani neyo. Ambedi seka menya yi, kumatado. Wodo anka fa nyamma, ningi ninkalika ke menfe. Kana siga, ikana maluya. Ikana dusukasi. Iya inikalike. Nedi jabi, ana husu fana ya, o fana di jabi, estara ya, alele ni kube kuna. Adi jabi, nalaka ijabi, Anglikano, ni maro me famu, ya ama ini kaula, ando ofie, kana bo jime foro ki kono magusi. Maninka ya donkli fendo, ki kana bo jime foro ki kono magusi. Odo, kuma mimra ki kono yo foya. Okay.
Thank you, Ibrahima.
You're welcome.
We acknowledge that the past year has been especially stressful and painful.
Ando be akalama, sanfla temenin kono, abrake san gufele mbalia amblu. Jusukasi yado, joro yado, slan yado, kono fli fana yado. Munko son jusukasi rojondi. Moi la barabratien, do la kran robratien, do tisla wala tramala oko, klendi, katrete an africanuma. Anya famba taxi la bourledi. Anile taxi la bourla, mwate donikun, ni momi donikun, aitenyon nya ila nya sima, ikalo di jusukasi. Bon, an famba fana barala restaurant nido. Restaurant wul fana, na fala ko mo tola damni kelaye ile do wala sorna le do wodi beleya ana bato kerolu meni sella misilla afo misfla mosque meni wala sella misilla na fala kitse wala sella misilla ba fu e ma bonyo kona wodi belela de bulu ambe kalon anya dina o yan lo la ko mina ka jamado selike do jamado selu be ma bo nyokona o kugule mbale bi wodi suma kasi yana slam fana yando ay flamma ko fear slang fana bram go siamana slang ko ila batorodo alika ay dinyol ko afoli rollo ina sani sante mene bragbele ambelema anu klente de dunya bele Europe yado America yado Middle East yado Arabu jana yado an klente fe dunya bele ndo ro an klente so ngelente ndo an klente slanite ambe de lanela koni ala nyuma bardo tun. Okay.
The loss of loved ones, jobs, businesses, homes, and livelihoods has been an enormous weight for us all.
Yonka fonya mazze. Ibalo srona romindo. Idi nyomeni. Inimeni bato kala nyonfe. Inimeni baro kala. Nile taxi borla. Momi donile kuku ile malo. Iwo malo. Nile barala restaurant. Momi ato Dominique la. Nafala ku bebra buluka. Nafala ku misirlado fana bra belea. Ikalo obe discuss ledi ambe bulu. Wele kuso ambe kalon. Ina samra belea ambulu nyama. Koni ku jangaro tanata jangaro ju tanata tofori kona basi amra wale soroni anyala tandula. Okay.
Many of you have also suffered from years of disinvestment, biased treatment, and lack of access.
Yanka fonya masise mo siama de bra ila na fuludu ila barada lo koni basi ntambulu wule ka ambe kono rofli jankaro yi belko jankaro yi koni basi tay ni ka fo sisan kun kunya dimna adi basi sedima dafo advel clinta wala aspirin clinta kodi kundimi suma koni jankaro nale basi tay mo sima basi sron wule tere beslana akudo. Okay.
These experiences have reinforced cycles of trauma and created a lack of trust towards government and healthcare.
Follow aflana fana basi masro ni basi masro jangarula oye mo islanale kele flana fala kuna frente ntay jonjon kuna frente ay mune kala mo wala nakisro akato ay kladi ni kun kidimi wala isen kidimi ya fon semrandimi ko ni te yamma basite kele kuna frente mi kota fala yen ne kala wala botoron wala asababu le no wasima soro wala ka beslan litra ambeslanga. Okay.
We empathize with those who have historically or personally experienced discriminatory treatment, and the work that we are doing to educate and gather information for the community on vaccination is keeping these important truths in mind.
Ay ya fama momen maseka kuna fenjonjon surala killing sana fana akala momen yina ku ne tatendo ku tobu la kole wala fada fi na kole wala american bansain na kole ni wala kife fragbele de wala kole ni ando be kalon tunarela aussi an bela kole ni obloma ni momen no kadake o rolona wala kula crossi il a voté que rollo il a dominique rollo wala il a marollo foka foko kile tere ni do wala ile nolendi ye ya fama ba an nolori amase ka kuna frenjonjonde ayma atmairela ay ya fama.
I want to set and share some community agreements to ensure that we have a productive conversation this evening.
Utameninko anya fesisen de kru ya nakeke espagnol duo arabul duo chinois duo ani wo bebra benkanklema ambra kuma la so bema koni anire ana africain an ne tayen tente kuma bra se an ne makala se ay bema ka fo ko kuma ko jonjon jumane anye mun kunate ro ay tulma lo biuranna an ka to kuma me fala.
The first is respect everyone's opinions and concerns. Everyone's experience is valid, and we want to respect everyone's concerns tonight.
Anya kona fan fala ma mriya mrake menfe ila mriya fo andi la mriya men antulu ila andi la men fana ni islam ka kido uro fonye anyo islam buido kondo film bana kida yo kondo flu fo ne kondo fili nde ya muso ya wala ne bola sudo ni don tedeo ndun la rijmai ay Maninka ayam be Maninka ando fnafie frem rakula ando freni ka o freu football already. Okay.
Today, we want to share with you what we know about the vaccine and answer any questions that you may have.
Anka fonyama ko kubara balea kuni alati jankula jila ama basilaji ambe bro lonko ma mandin furuba kan lolodi mandin landa lolodi mandin sanda lo fanawdi ambara basi surala basi bira suro jankarunna ro anato basi nya fola yeni basi o suron toro jon basi o klanya joma fanani atlat ma jona jone fana kan ka basi fana ke anyole bi barula uranna. Yes. Okay.
I want to introduce you to Dr. Flores, a doctor from Health and Hospitals, who is here to answer any questions and also present on these topics.
Ang bansante an ten la baru bansan kelaya ani bomi ni akla bomi ki spécialisé ni kuro ya fo Dr. Flores we yan fe uranna ani menu ire dele ni ku kela anya ire de ma we fana yan fe ka kuna fre andama ka ko nya fo ani andala sai manyamma kulubai nura.
Okay. And with that, I'll pass it on to Dr. Flores. Thank you.
Good evening, and thank you all for inviting me to have this conversation with you tonight.
Good evening, and thank you for being here. And thank you very much.
You're welcome.
Yeah.
Okay, we want to start. I want to start by going over some information. Some of you may have this information already, but to some of you, I hope I can clarify and help you make the decision to be vaccinated.
Dr. Mini, atoko Judith Flores, we specialist in Kule kuna. Especially drone to drone anale akato kuna friend la male. Andi mina joma. Ankato jangaruni silam wala nyajoma. Jangaruni timina mgo fe nyajoma. Kakato wo kuma dando le folanye anya antulo malo ni kuma la kusebe. Kominka fonyama Dr. Leti, Dr. Basantide, Dr. Flores Leti. Alifana kaninyalon katma beka.
Yes, I'm a doctor that was in the hospital during most of COVID, of this COVID surge, and now came out to do work to make sure that communities get vaccinated and can move on.
Dr. Mini, kaba dam natma, Dr. Flores Mini, ay Dr. Lady, kwani ni jangaro fana nale, ay kale le loni ko nyefe, ay barala hospital la, ale ni ba jangaro to ile nyefe en direct, ale ni ay nyomblo, ublo ma ale nale kani ko nyefo anye rerele, fana kana kuma ijabi, ba kanka fo nyam makurma, mo tuslanintre, mo bila konrofli, Dr. Tintain.
Thank you. I see the vaccines as an opportunity for us to get back to life, especially after the very, very hard year that we've had and all the loss that we've had.
Dr. Flores ni, ale bra basi ye, abra basi sura, ale kelentare, abra basi suraro. Uroro ule nya fota yeni, san flat teminin keleni, san flat teminin belemam keleni, aktoli nya folani, sa anketo umna la nya joma.
Next slide. COVID vaccinations in New York City. We've had good success in New York City, but we still have many populations and neighborhoods that are very low in vaccination.
COVID-19 ni na flama ko murawanya. Agbelea koni amra la wasa sura na flama ko succès. Amra la wasa bali sura mundo New York famba braba a pirikela buluté kela ambeka buluté lon kabe ando manama buluté trekela amblu ambra nyama buluté ura kedamna.
We still have a lot of work to do in certain neighborhoods, in Staten Island, in Northwest Queens, in the Bronx, and in East Harlem.
Siamo caro, bari rodo yi alibi tokajeni. Siamo caro tokajeni. Rodo Queens rodo li Staten Island rodo yi Bronx rodo fnai ani Manhattan du Malaya for Harlem fanfela ani is Harlem ulu fanfela do mwasiama ma akuna friends of loka vaccine ninkai konika jama valori jama valero faida ngira for New York telantelori wala New York car en car wolori.
We have work to do. We have a lot of work to do. We have entire populations that are not vaccinated at the rate that we need to protect all of us. We see it in our communities, means in communities of Latinos and Blacks, African Americans, and some young people that still have to get their vaccines.
Ambekalo bara lambu. Nika New York lobe feda mo million tan ani nanne aflama ko 14 million. Na fala ko mo dando lebra u pigri wo ke boloteke mo fankle rema mo famba rema boloteke vlo deni yaro muso yaro frafin yalo ani africain yalo men boli africana kamembalilu ani African American min fanaskirian ani Espanol min fana.
We have the opportunity to meet a lot of the barriers now in New York City.
Ubloma mo fam to foleni ala sonama anke to amra steka wili bela soroni anke to ko bella soroni Anna kumanido ani kumani yomen katamblo sukonlaldo ani television lo.
If you're worried about cost, these vaccines are free. They are available to everyone, regardless of immigration status, regardless of residency. We are even vaccinating people that come in, that are traveling into New York, and we are vaccinating in people's homes.
Community kalo ambe afula America ko be wadi lady. Ko wadi lady ko ni wadi taro. Wadi taro che taro muso taro kune immigrant di ko taro kun green card temblo taro al security blo taro for New York kuyani. Wala New York na la minindo. Ilise blo tila vaccine nikala bansan drosekelin te bolado wadi bolado wadi mani nikala ado fefe ubroma alabla lempele.
Next slide. COVID vaccines are available in the US. There are 3 vaccines that are available in the US: Pfizer, Moderna, Johnson & Johnson, which is also known as Janssen.
Blotemini, American, ankate dunia fambe made kone American, a Swiss balea. Swiss bao, follow emini, Pfizer. Pfizer meori, oye, basi dobena do lady, ambeka wilong. Aflana, Moderna, ufanae, basi do fanari, men fana adobena kalabla. Atokle, asabana, Johnson & Johnson. Johnson ambe koilo ne retre wala femalo la ila biro line orodo basi sabaole Pfizer, Moderna, Johnson & Johnson o pikri sabale mendi sekla ka jangoro ni basi.
These vaccines have proven to be safe and effective and were approved by the FDA for emergency use authorization during this pandemic.
Basi me fana vaccine men fotoni pikri men fokoleni te feta ila feta ila ba kuma woyolene a kunne ka pikri ke entana se bien sorna ko ne ka pikri ke adin cheya sa obey mankanderi.
I'm so sorry.
Okay.
All 3 vaccines meet their goal. The goals are, you can go ahead.
Pigris roman na saba min foleni. I be kunklene la fanani, I be tonoklene la tonoklemini ka COVID-19 kele.
To keep people from being seriously ill, to keep people out of the hospital, and to keep people from death.
Aye tono kunkelen pe la kunflame kunkelen o tono klemi ala ole men mas solon flo kulma tanka men bra solon na je leptanin na kulla kendea men fanaye ya kanel bra solon we kana lati men tol manyama ayo la ku kun saba kunkelen le be kanka basi saba ni be ka madobe.
We have seen over 250 million people vaccinated with these vaccines, and the goal of the vaccines have been met. These vaccines are working as they are supposed to.
Men bra pigiri ni ke mo million kemefla an talante wili bra pigiri ni ke fe maya ila amato ma juma sisaima ado pigiri kale kumina abra wukun soron ko basi bra nyai o pigiri ni feta la fe trosita la na manyali katana tiali kala.
Next. How COVID-19 vaccines work. It's important to understand that yes, these vaccines seem to be produced rather quickly.
Basi meni COVID-19 pigiri mi yeni ake ay barak la joma ay dunamo ofadila nya joma ay ikenda nya joma ay matangala nya joma wele nya foto ni kwa klen ka nya foye.
It's important to know that they were produced quickly because we had the resources, the monies were put together by the countries and by the companies to get it done. We also had the technology. We had a lot of technology that was already there that we could build on in producing these vaccines, and a lot of cooperation, and a lot of people volunteering to be part of the trials and volunteering to spread this vaccine work throughout the country and throughout the world.
Ambe kalon jangaro nale bilalankan bani basi suruna ka triale American government ka wadi rel daro mo de fana ye volunteer lu men ka boyiro ka dogbeila fanani wadi donado America donatere America na fula wa dunya fambe fe kuma anka fo nyama jangaro mi America lente aka dunya be lafu koni America le dunya be capital li wala ko sa America wadi badalo saka basi suruna nyama juna
So being able to put all these things together, these vaccines were developed without having to miss any important steps in the development of the vaccine, just like with every other vaccine. All those steps were met.
Pikiri ni na nyama, yanka fo nyama, adobe na trialo. Ama dobe trialo mi wodi o make basidi de, but dobe na trialo nyama saka mol matanka. Saka mol basi. Obuloma anta flanka dobe ni kariya do, alobe na anyuma irerella. Yes.
The way these vaccines work, in all three of them, there is no COVID virus, and you cannot get COVID from these vaccines. There is no virus. You cannot get COVID vaccine from these vaccines.
Aido ko frani ko pikiri sabameni. Itana se COVID-19 sronalo fifiu anale wole basikama. Mundo iketo fana sronalo. Kuro COVID-19 te aro fifiu pikiri sabano. Ataro le fifiu sikate mendo koni.
The technology allows the vaccine to make a copy of an inactive protein of the virus, introduce it into our bodies, we copy that, and then we make an army of antibodies to protect us.
Kuma meni faida anala menado ni nike te technique maroi kwani nina foye kamano waya. COVID virus ni pikiri ni keto adola doni farido. Naka adola doni farido wodike kodoma mi kokele. Na kokele wodike saka jangoro mabenka bi farila wala ka jangoro go farido.
The Pfizer and Moderna virus are based on the same technology. The Johnson & Johnson vaccine is slightly different, and I'll explain.
Amka fosango pikiri sabale. Pfizer, Moderna, and Johnson. Koni flow flawlu uliye barla nyakle nema. Sabana difference doniye kon Dr. Flores dina o nyafo anye sisen.
Pfizer and Moderna vaccine are based on a technology which is called mRNA.
Pfizer and Moderna to fly ye barla nyama we technology mina barala ay follow mako ay follow manya joma we barla nyama flama RNA.
It's been studied over 30 years. And again, it's a technology that allows us to make a copy of the protein that's not the virus, just a copy, to allow our bodies to make the antibodies to fight the virus itself.
Anka vaccine mani RNA asam bisabale ni faida ayala abrala bara ayala bamgo yala barala koni ayala barala joma aye a copy de kela ka jangro da copy ke kuladu ifarudo se jangro mi farido udo kilenyamma aye barala tini.
The Johnson & Johnson is slightly different.
Anka fanyamma flawo ye baranya klema koni Johnson doni franfasia difference doni ye ale ni fla follow we nyonte wono barato nyamma Dr. Flores kanga kule nyafansise.
They use the common cold virus as to deliver the protein, the COVID-19 protein to the body You cannot get a cold because it's not an active cold virus, but they put this piece of protein on the common cold virus that we get all the time. That comes into your body. And again, we make the army of antibodies to protect us.
Kumanka fanyama pigri mengla Johnson bro. We nala mura aflama ku cold virus ayonala aikala anya aflama ku mura wanya. Anya jankarano flama ku mura wanya. Pao mura ere mengla mola. Jankarano wele kala mola fanani. Mura jule koni mura ni mura betekleni. Wala ukole mura wala do tu farido. No do ni farido wodi COVID-19 kele. Zing. Wala ka COVID-19 bagabang.
I want to assure everyone, again, these vaccines do not have the COVID virus, and you cannot get COVID from the vaccine.
Anya feka bet kan di bema kan ire koni ka fo basi meni yeni atana na jangro jula sinema ka do yu ya fola a ne ka basi ken tana se den sorno ko so do ya fola a ne kanita adina konon tana kono tala ko chedo ira fo adi nko sa adi cheyasa basi meni atana o sila silima andalen fanklipe kama fu ka COVID-19 kele.
Next slide. Thank you. Next slide. How well do the vaccines work? All 3 vaccines in the United States meet their goal. They keep us from serious illness, they keep us out of the hospital, and they avoid fatality or death.
Basi sabamen foleni. A sababe munekela. Sabamin from American. Sabamin ankantero de made sabamin konindo ben American. Uje parlanyo joma aye duni faridonya joma aye munekela. Follow kima tanka kabo jangaru juma. Flana abra kemenna leptani ku weekende ya ku bla ku labo ka ifadi kende ko aye ulekela ate dogara sikela ko. Ani sabana ere fria ambeslani sale. Ura basi mina to ku kasaya imatan kasaya la kimabola ambe wulina. Ulo ayo barlatini.
Many people wanted to wait and see in the beginning, wanted to wait and see how these vaccines work before they got vaccinated.
Ikalo mo siamant niskasiga ni kuro. A kanya to follow men no lukake kuno lubana kela anda long ay barala nyama.
Well, the
good malo la kuksane vaccine ka follow fire to mo follow yake.
Well, the good news is time has passed. Millions, hundreds of millions of people have been vaccinated, and the vaccines are effective and have proven to be safe in these individuals. So we don't have to wait anymore. We have the proof.
Ahere maro romendi. Molt deslana roronye ubebra baro. Basi mo shamane ba mo shamane bra basi ni tigri ni ke. Ama felaida ama trosi seima. Ubulo sa mo la lentre. Nyama kono fakal zake flo fakal zaka ke olo musaka ke olo anyo tama kono ka fle angono ke makono ni taro ko ambe anjija ka amadon ka vaccine ni ke bao trosit atana torla sima nama na fasima atana torla silima.
Next slide, please. What we still don't know about the vaccines. We know that people have been vaccinated for over 10 months now, and those people have not gotten sick, severely ill, have not had to be in the hospital, and we have seen no significant number of fatalities or deaths. So we know that already for over 10 months, they've been very effective.
Joma kupasini nafala. Moto librake faida karotaneti. Ama trosaima ama jangrosaima. Ukura mundi nafalala.
There's much investigation and research being done on whether we need more doses or boosters of these vaccines.
Rekreli ani fesefeseli ani segaseli librake vaccine kuro. Abis karu woroleti. Uro mire tesa aida fokuka la wanya fenya masaka basi fankadu wele ido tintinti.
To date, it doesn't look like we will be needing boosters right away. with the exception of people that have certain illnesses where they don't achieve protection with the vaccine.
Bikoni, basi fanka donku ukmataroko. Ba fanka braba donakaba. Meire prosituro, mei mankanto go fofeko. Koni. Aye akafanga kadu meni akafanga kadu mogomenima jankoro wore tre mogomen nakroma. Jankoro wore tre mogomen nakroma ni COVID-19 bran la lawilkan. Udo basikan ka fanka don kan ka lawle kan saka COVID-19 kele ka jankoro kolome la ku fana kele beban.
Maybe people that have had certain types of transplants, like kidney transplants, or on certain medications for blood cancers may need boosters. We don't know yet, but they're probably the people that may need more vaccine.
Bari mo dando yi foku fankale do wetaro. Fankani ke weta COVID-19 vaccine no. Mundo jankoro wurete lakodoma. Yafo jelde jankoro mogomenna, besekuru jankoro mogomenna, ani jankoro wure mogomenna, meni sani jankoro kolota la sani ka COVID-19 renate. Uro aile taka ka fanka do nyadoma saka jankoro koloma ila ko basi al numa basi ka banfeu koni kudani ko ay matanka kudakana na fraka.
A lot of people are talking about variants now, that the COVID virus is changing, and they call that the variants.
Mo sema todo yin ko variant. Mo sema yo kumala sokono ko fana ye kala ka COVID-19 kele. Variant no ama lon folo koni ni dalu kende kakambulu andi se kumala kan variant na fo VARANT. Ufana kuma idoro o fana ka jankoro basi. Kona amo londe.
The variants are known as alpha, beta, gamma, and delta that just came from India. But a variant just means that a virus changes, and that's what all viruses do. They change with time.
Variant o yebola rojon afamba yebola endle do yebola shin ay jankoro brele basila. Koni ni lone mema variant o lone jankoro ma wote COVID-19 dide. Do ya fosa nebra varianta ma ko vaccine ko COVID-19 vaccine na ukumate ba variant o we jankoro brele basila. COVID-19 vaccine wona le COVID-19 nekelekama.
The concern about the variant should lead us to have more people vaccinated.
Kono fli me anase ba ni tona la kosuni tokana do di bedi kidaka ko ko basibira ke saba wala basibira ke nani anslani oroleye
We think
bidi kilaka
they may spread faster.
Ba basikura mi variant o tumaro adi jankaro worelike adi warobe amalo na songo kanowa wala moya na kokuda kana berita fregnala kona amalon na dinna gense kuju juna koni ayina keta falaye ankan kan janto romendo.
So the key to dealing with variants is that the more people are vaccinated, the less problems we will have with variants. So far, the vaccines that we have here in the United States are working well against the variants so far. But we need to get more people vaccinated so these variants don't infect others.
Ikoto basi wirela nyanya joma ni basi ya ambulo kama Amerika. COVID-19 basi ya ambulo ya. Uro variant kuntala mukoso amalon uro benyama amalon me uro koni COVID-19 vaccine ni buloteni da lubra soro kende menum ke koroma lubra kende ya menum ke wa maulu soro fro uro kan ko rele krosi kan jantu variant kondo kusbe.
Next slide, please. Who can get vaccinated now? Practically everyone over the age of 12.
Bibi Amra fongo COVID-19 vaccine braso. A pigiri braso. Bari John ne kan kake. John ni kan kabuluti. Musuya taro, dulanya taro, chea taro, denia taro. Kadan na isantani flama kaile. Ubekan ka ebuluti. Funi Amerikiani.
Young people from the age of 12 to 17 can be vaccinated with the Pfizer vaccine only.
Menu koni kadam na santani flama kwasi santani urulama. Udise vaccine la fenkle mina vaisa leke kanka pigiri koila. Santani fla kwasi santan ani urulama. Pigiri kanka wila utole ku vaccine.
In the future, we may see more vaccines available to young people.
Tomorrow, juna re banka fosise America government ra nan fulo rele dondo ani technology rele dondo sakani kulateria. Uro santani fla santani urumlaw asiama do sisensen aidina ke vaccine ready na ka do fra fanka kansa deni meni uri santani urumla santani fla self na dise vaccine la nyama sakali jang ay matanga jangoroma.
I want to remind everyone that the vaccines are available to people and your immigration status will not be affected, and getting the vaccine will not negatively affect any future immigration work that you have to do in this country. It is not affecting that. We also protect your privacy when you receive a vaccine. We do not share information.
Ando bekalo an africainu an slani romie with immigration code. Na kam nan lose ada wan Afrique na kam nan lose ID musula wa Afrique an africainu ani frafimbe an krentori frafimbe o slani romie with immigration code. Kuni vaccine ni atena la usika maitena maini kala green card tiku isanjele amerikini idoni lojon musujoli bulo itena maini kala usima koni mietu abdo fanani wodi tesar lado kafo assurance tende kun okumataro bel kan kanike bansan.
If you have no insurance, you do not worry. You will not be charged for this vaccine. If you have insurance, they may take the information so that they can charge some administrative costs. The pharmacies, the hospitals do that. But if you don't have insurance or you don't want to share your insurance, you don't have to. This vaccine is free through the CARES Act, which is the federal government of the United States.
Ni assurance kelibulu, ni assurance makebulu, ikana sran wa you are vaccine ke, you are pigiri ke. Ni assurance lo kakibulu, ikana for assurance ne buluntana wala pigiri ke la. Wa assurance ke, wa pigiri ke. Tomorrow, pigiri ke una ajikaila ulu, mwile finance ile me kan kasara kolike. Tomorrow we di bo ila assurance la kila pigiri ke. Bikana to bona le ka foko assurance nebulo wala ne immigrant di ne na immigrant di kene to bona le nyasima ni mwaka pigiri nige.
Next slide, please. Why get vaccinated? I'm going to ask you all to think about those of you that have gotten vaccinated. Why did you get vaccinated? Think about it. You have reasons.
And may Mandinka say, undo ki boloti. Tense ka boloti. Ka pigiri nige. Anyo Mandinka la ika kemu kuso.
And share them with your friends and your family, especially those people that haven't gotten vaccinated. Talk to them about how you got vaccinated and why you got vaccinated. They may need somebody to talk to and listen to them.
Ikalo kukumae fala kumalefe. Nile bane boloti da kaban. Iwa ya fo idi yoye nebra boloti. Ambole boloti rolani. Wato boloti rolani. Ufanala se doma. Uro kumadi se bema nyama kafo. Fakar sabra boloti. Fakar sabra boloti. Indian sabra boloti. Ukoma beriwa ka boloti. Dondoni sakana ke kujudi nyama kana ambete anse mamboloma.
It's important to remember that the coronavirus and COVID-19 has not disappeared. It is present in this world and in this country.
Men ankanka dekanka te menka. Coronavirus meni na falama ko virus ni. Bala umeni wala nya fuma jankaro jumi nani. Amo flode ka fo ko a kun na len karo fla karo sabale kama kadi bansisen. Ukumate ayan flo amo rosi. Uro fanya ambulo tele kama tankala nyama juna.
In New York, there are many areas and neighborhoods where the vaccination rates or the number of people that are vaccinated is very low. So that puts us at risk to be infected.
Amrak mafo koroma. Kiko ni amrak mafo. New York na lamini ndo yang. Bulote rodo yi, bulote kalo bali. Mwasema bulote inflo. Ukoni wojura na ba ni mo ma bulote fone mana ma bulote adijan korolati me men bera bulote ma wala adijan korolati me arela bona mo ma. Kuro anklane fo be bulote le.
So being vaccinated helps us prevent hospitalizations and the complications and deaths due to COVID-19.
Niki bulote adi jankarola ginseng adi fesgola jankarola na ginseng am wasima ko folo flana moyi wam kala laptani wo adi dobola sabana adi dore bo jankarola ginseng na deni wo mo malu adi dobo bela.
We're still seeing many people throughout the country, especially in those areas where the vaccination is low, those states in the South and the West, that are being hospitalized for COVID.
Russia mai America New York le lonte de Russia mai America nyafe men mal buloti uro men mal buloti anyo fana ko mena ay wala labtani hospital la wilali labtani ba ko COVID-19 bre esro mono ko ke vaccination balia ko vaccine balia wala ko son ay jangarola wala ko son jangaro ni gensenale foni buloti mak.
We're seeing a lot more younger people under 30 become infected because they think that COVID is not around anymore.
Anu fana ibra afana amra dimsen doyi with Teslana ba yafla mo ko ba la jangaro ni nisa wala a kunde kende ne deni ne jangaro tisem nala o be wiya adi se mo bam na nyama adi se ka deni fana mate udo ayla buloti bali awro no lumu buloti uye jangaro na jensen no wala jangaro ba la kala temi juna molma udo faye buloteli.
And even in these young people, we see long-term effects of COVID infection related to their ability to feel well. They feel like they have a chronic disease. They have memory issues. There are lots of long-term symptoms to COVID, and we do see them even in young people with very mild disease.
Ando bra ifna dimsen nu bana kelani ne dimsen di ba amra dimsen do yi amra dimsen do ifna labtani COVID-19 ni a jangaro ila kuni a jangaro ila nya joma abra watini kaila ayire malo fana mo malo ka ayila kuni funa na lot mamna ala kisi kan tanka uyasro mabra waka danke udo akele kafsa dimsen ire blok tik juna katemi ani bekan kankaro.
So to protect ourselves, to get our children back to school, to make sure that we get closer to ending this emergency and this pandemic, the more people we get vaccinated, the fewer cases and the more we're able to go back to our lives.
Mo sama funi mo liye vaccine la way bloté saka ide kendia kai kendia ka jangoro ben kama boila kul di kosin anyama ya for restaurant di laka école di dalaka bisu di dalaka uro bloté le kavisa bloté ne kavisa koni rekle kredi katma fembe kan wolo anyam bloté any wakwa bloté ba wole na faya na wole kato COVID-19 ire kube bolokala.
I think it's also important to say that, and I think many of you know, that coronavirus, COVID-19 is not similar to Ebola in the sense that Ebola is COVID-19 is a situation where it stays in the community and you can have many more people get sick. With Ebola, people get deathly ill, as we all know, and there are certain treatments that we use for Ebola that we cannot use for COVID. COVID does not respond to hydroquinone, and COVID-19 is something that you can catch from someone very easily in your community, and it stays in the community. So there's a big difference.
Afofanani ba mo shema fula anumra Ebola Ebola mankana na ko fana bawa COVID-19 fara na ko fana dinatemi kwani klente de jankoro flani kaja nyona aye mosro nyama su klente COVID-19 ni ale turale coronavirus and flama Ebola tre wala kana kwani COVID-19 ni ale jensena le mo linyote na do jensena kaba na ka mo klen soro mo ofla na bana mo ofla soro na kaba adi jamasro adi sula soro nyama.
And we have a vaccine for COVID-19, which we don't have for Ebola. Next slide, please. Getting vaccinated. Next slide. So where can I get vaccinated? You can get vaccinated everywhere and anywhere. Pharmacies. You can get hospitals, clinics, Department of Health pop-up clinics. They are really everywhere. And if you want to find it, you can go to NYC.gov vaccine finder, or you can call this number that's on the screen.
Uro bullet la rojo. Iswa la pharmacie la. Ali ya CVS la idwa pharmacie la, idwa Laptani, idwa Roro, idwa ki buloti. Nido ma buloti rolo ni talon. Alors téléphone be bolobri, il a porta membre ya foko cell phone. Yo ta dron, ye numéro ni ke. 877 UK.
Merci.
82 UK et 9 K. 46 92 yo fanake 92 ni ko ke il a la il cro et donc anya fa ko 870 77 829 46 92 ni ko ke cro il don al ni ka fo nete computer lo non téléphone ni bolo kaban ko téléphone portable ay bele boloti tisa fala nete temps sur na ye wole ketum ni ko ke ali sendo isakla robe.
Thank you for giving them the numbers. The other thing is that if you feel you can't leave your home or you have someone that's homebound, you can call and have the vaccine given in your home.
Uro de kala mo bete suglendi ni ka ke bona wala même da accident do ka kroma momli accident o moto accident o ni sen kadlen ka ke il te bola bona wala inya fini.
You don't even need an appointment. You can call, look at these resources, find where you can get your vaccine and get it the same day.
Ali teseka bobona, ali mabobona, ali nyafi ya fama ku aveugle, it sebola itero ila. Ye mo nika wulele ketu mo dwi tere, kitre ko apikri kidai.
And you can even choose which vaccine you want. If you feel like you want a Johnson & Johnson, you can look for that one, or the Moderna or Pfizer. So we have so many opportunities. It is amazing. It's a wonderful, wonderful thing that we have all this.
It is in your talafana. Kafo ne Johnson nefe. Wala ne Pfizer lefe. It is in your tala usababero. Yake mentala te komi diaguyale fie Pfizer ta, diaguyale fie Johnson ta. It is a asawaro de clientala. Fie a klanyanya ma ya sabia adole ya de clinke.
Next slide, please. This is another page of the vaccine finder. Maybe you can share with them that this is what it looks like. They can select a language. They can look for vaccine in their neighborhood, and they can find where they can walk in to get a vaccine.
Well, inya sebe menani. Eklama ko location isro na rojo. Nika ke quartier mina. Irese ka oro fenge. Irese zip code meori. Nika zip code ke. Nika ke 1102. Nika ke. Wala nika ke Harlem. Wala nika ke comme moye Harlem nyama 1026 nous faisons. Nika ke. Iri nika oro ke dron ka zip code di dron. Ida fo irese wala buloti la romi. Ida fo fana nyama. Irese wala yakube kla romi na saika jankoro. Imatan ka jankorona.
Next slide, please. You do need to bring some proof of eligibility and consent for a minor, but we also take consent over the phone in many situations for children that are 12 to 17 years of age.
Ita fovana ni ko ina de sebeledi ka fo a sani yana papier ne di ka ida ko ndi se bibliothécaire a funi ka ga dendi de isoronda ne certificat document wulu ina o de mi ya fola a nsoroni sanela wala nsoroni karonela wala bibliothécaire sekala euro.
It's important that if you have a child, a young person from 12 to 15 years of age, a parent or a guardian should accompany them. But I think they're also accepting written consents these days. And that's something that you can find when you go to your site.
Urofanani denini kadam na santan la flama kwa santan ngrum lama ni abaka ke wala mogomi ko gardien ide yemen bulu na aden dilima iba idente koni ibraba talaka ba kone de jantaro wala ne de adomna ikoni adomna nyama legalement ikana fo a kwa denta kwa di anyu wadi kwa blote yi wadi abramol yalon afayalon fanani wala afaye sebeke ka fo a nebra dien di fakar sama ali se wala ndendi kwa blote a fala ku consent nado fado ke wala nado ke ka fo mra dien di fakar sama ai wan dendi ka blote o fana di se kala na di ke blo no di ke ka dendi sa blote lauro.
Next slide. Next slide. Common side effects. Many people are concerned about the side effects they think they may get when they get vaccinated. It's important to know that most people report side effects that are limited and that it is a normal thing to have some side effects with these vaccines. It shows that your immunity is working.
Muno information jonjo madaima ani komin ka fanyama ani ka bolote nche yadisa ninka bolote ndina konota wala ninka bolote nkono ma edem nani ndendi na sankono ote koni niki bolote koni adi koni sima jangorto ifna dide ay fama ay femisle ma afoko adi fendo du farido fenjuto di koni adi sere ukelida ido la sobi kone to jumani kana slan woro nya ki bible te koma.
There. It's important to know that most of the side effects are short. They last for a couple of days. They're short in duration and last for a couple of days.
Fana niki bolote tumara rise idi bolo dise kumuna dodi ya fa bolo roni o ituka akili bolo na odi kumu ya fa bolote kele wala da ron na funu flana adi wanyani ke bolo rola ituka akili bolo na adi wanyani kula fanani ala adi murani kila a side effect minaola wali trompe wori ani kundi miseni kundi mbate bari ani ki sege doni ya fa ki sege leno kroma idi sege woni bola baradi ay fadi di sege fadi dokumu side effect lo di side effect imundi ana kando ayef no min lalila ni ko teminaka ba ay forma go side effects.
Yes, the side effects are usually, as I said, within the first couple of days. They may consist of a swollen arm, you may feel tired, you may have body aches. Not everyone has side effects. Maybe about 1 in 4 people may have these side effects, but they worry people. And sometimes people are worried they can't go back to work. So it's important that if you're having particularly a vaccine that has a second dose like Moderna or Pfizer, that you make sure you give yourself some time the day after to rest.
Koni nika vaccine ni ke ko moy fere do kete klindi moy fere do kete nya do ma na ida ka kesise ama fusikila wila bararo wili wa bararo yete mila ko ife koni naka ke mo mena ni mom kale pigiri ke abari fere do ko mundoni na abara kundi minimlela abara nana ni kadi kuna wala abara wanya ni bila ibura idi setula luma idi tu bara katile flake ali ni ko fo la baradia do ni ka vaccine ke wolo mfa document dona e da fo ide tanato yina baradia baybera lo fira vaccine ke sa vaccine baradam na nyama e da to ye tele flaw ki la ye bara ye ma barake flo woro yes.
And you can take some medication. You can take some Tylenol, acetaminophen, ibuprofen, Motrin after you take your vaccine, not before, so that you can feel better those few days. You wait a couple of hours, then you take your medication.
Ni na ki fari dokumu wala bra fièvre doni kila wala abdi ik fari dokumu nyado ma wala ki sege idi se basi sero tala idi se Tylenol tala idi se ibuprofen tala idi se Advil tala bari ukitanya joma ibani ko vaccinera ni bana vaccinera namna idi basi se wolta naki fari dokumu bila koni kafo ne bra vaccine maraba basically vaccine
Yes, in many cases, it's just like when you take your children for vaccines. They have side effects, they have a little fever, they're tired the next day. It's very similar to that when we take this vaccine.
Fanani, aka fasisan side effect mi falan mako basi wala basi none. Aye rone mekela. Nido kai data kwa disi bulutiro. Nindala dindi. Udu sagba efri do kumundona. Nenani kaila, nenani di kaila. Kundimini kaila. Rawul bay side effect mi afala mako wesite basidi bofani fi bulutile kwa vaccine ke akbaranyema.
It's important to know that the CDC reports that most vaccine reaction and side effects occur within either the first few hours or the first few months. There are usually no long-term side effects to vaccines of any of the ones that we give commonly. And that is how we feel this vaccine will be. Long-term effects for years later is usually not the way vaccines work. Their reactions are within the first few days or the first few months.
Ameriki organization mi Ameriki kuna sigi me na ye jankaro ko benya fa ko CDC obrafo ko side effect ni atemena telefla telesaba tumara di karoklen restaurant ko na temena wala kwasi sanklema aye wala doctor bra ka fa ne bra pikiri ke alibi infari dokumuni alibi segele yiwa kwanya fila doctor bra kinisi bonaro koni karokle dokun fla ali mo doctor bra ro we dirnan koledi.
Next slide, please. Next, what to do if you get side effects? We already talked a little bit about that, but if the side effects are severe, or you have any chest pain, especially in a younger person, chest pain, or if you have any swelling of your legs in a woman, if you have any severe side effects, that you should call your doctor, your medical team, or 311. Really, this is something that would probably happen days to months after your vaccine.
Amra for season ko a side effect min kala ate juela telefla telesaba alisi senfununa adije ka wanyani kila adisi kundimina wala adi faddo kumun kila wala side effect li ko naka temin telefla la ka min lokuna alibi kundimina wala tri kala nikiri kido tri la wala idisi do jale wala idina kri do jala nako kadron I wila doctor wele ka fa ne bra vaccine ke lokun kle de ni lokun sabaleni tselani nakla tsela damani kala ila doctor wele ka fo ikrokroti.
Most side effects go away in a few days. If they persist, get medical attention.
Ambra fo side effect ni kon bala vaccine ni talaba telefla telesaba telenani adanori ko nate mano kan kro ila docteur wele ka foi mara vaccine ke kona telenan neni 4 jours leni wala 5 jours leni fari kumuni kan tsan nakla no ka kadron ila docteur wele ko nya foi ka foi krokroti.
And please take your second shot for the Pfizer and Moderna. You may have a reaction, but it's very important. If you don't have both shots of the Pfizer and Moderna, you don't have complete protection against the coronavirus.
Dr. Flores Lekani, amra fosango docteur li, ale spécialisé le nukulido. Akuli ya flabeke. Foloke ibanka flanake. Kana foloke kawa nebra ban vaccine kelen talaka ba udine tawasa. No, ye foloke kabanka flanake. Ay sabari re. Aya flabeke. Kana klenke kafo netana flanake la. Neda anlo folo ni bo flamika ke no ibana nduanta ke utui iwa kwa flabeke krokroti.
Next slide, please. What can I do once I'm fully vaccinated? Fully vaccinated is 2 weeks after your second dose or 2 weeks after your single dose of Johnson & Johnson. You can participate in so many things after you are vaccinated.
Ngororo idi mu fos ne bana vaccination kela. Ni se mun kela. Ni bana vaccination flan kante kele ma ni bana flakela. Idi se ku shaman kela. Idi se terla kuido, idi se terla baraldo, idi se wala ibla jamala boldo. Pana asababe kela koni. Kana fo nebra klenke ni down makatimna kuife na ya bele kela flo katde timina kuife.
Sometimes it's a little confusing because the rules have changed over and are still changing over this past month.
Ay koye basana doni alibi anya fola information kolulu ali fin kukinyalu at the same way shaman kololo fila ba ambe kalon jankro da sanflake basina le nyamma oro ika television bla matma kuma do iro oro ijanto itruma lo kusbe ali se kondo flike la kondo flitaro jankro basini kain.
Basically, if you're fully vaccinated, you don't have to wear a mask when you're outside. If you're inside with people that are unvaccinated, you probably should wear a mask.
Ni bane vaccine kela anka flabelema kafo nebra vaccine foloke ntena nitu na bara fe ndi maske bonuna ya flabel kela ni bana flaklat mame idi se femboli nuna idi fo fanin kuron boy inunda la ka boy dala
You do need
wore le ni krenka ke kenema ko ni duna jamaro menu mai vaccine ke folo ye femble dala ye fanin kuron ibri dala.
You do need a face mask for many businesses, for schools, and for riding transportation. The trains and the buses require face masks.
Ali nika ke ni bana maski vaccine ke la kaban kan tekele made afla ni bana fla ke la kaban yoro yi ite fa bole nuna de kon ni kringa ke kenama yeso kono yeso nya fe di sa bole nuna kon ni nika ke kran rollo ya fa école sulla wala yidun to bisil kono wala yidun to terrain kono metro du kono kiwa tordo wala yidun to jama rollo ye fembe di nuna ye jagwa fembe di nuna.
Generally, you don't have to be tested unless it is required by a school or a workplace. However, if you've been around someone that's sick, I would still recommend you get tested for COVID-19.
Diagwele fanani, diagwele te asiamano wala fambaro diagwele te ke teske kaloni COVID-19 la wala tila bari ni ko ni ka jamaro ile wala karan roldo e kolsulla wala yi wala bisid kono wala ile wala glizilla wala yi wala restaurant na fo barla restaurant la diagwele ye fanunkuro mbili nuna kana ble inundra le ya ble indani inubella kalat me tulu kofe.
Next, please. Lastly, we all know we have to take care of our mental health, our family's mental health, and our children's mental health.
Sigate mendo ambe barla munkoso anyo para sokoma kwa baraka musoso sa anre kendea ana dimba kendea andinu kendea ansinyoni kendea ana bara be kunori ye bara la amerikian wala dunya fanfa ye bara la komi koso kendea soro ya dimba ya fana kende ya sono ani wala karo ani wala tele muani wala yare muani flakela o kun sawono wole kama saka kende ya sono.
We've all suffered a lot of loss, and many of us are grieving for the people that we've lost. This is particularly an issue with children and young people.
An bebra tro be sombra ja bebra kon rofli bebra nyani an be kalon san flani kono tro membra la an be kan an be kolon do la na flobra toro do la bara robra toro do la mombili bara re bara fenfena bebra febra la bela koni
Yes.
deni na kule kagbele
It's
deni na kugabane.
It's important to get these children back to school and back to their routines. And the best way to do that is to get their families vaccinated, the teachers in the schools vaccinated, and the young people, when they're eligible, ages 12 and over, vaccinated, so they can go back to their routines, which they very much need.
Ankalon anka fosi an ko mo shambra nyani mo shambra tro mune akela ile wala bararo ile den tiko den flani saba ido tiko wala idwa ibla babysitter bara babysitter fana den wala fana yo bara wala den di wana tro babysitter bara fo den nani den lolu fado fo den woro de ala den ala nakla den fla no e babysitter bara fo ay fla bele vaccin ke ni wala flo ye babysitter Maninka den fa den ba men nalia deni abra vaccine ke vlo ye ba fana donc ya fo kay bra vaccine ke kana dawo madre ye ten cancer kay bra vaccine ke tu den bla la ala kala kran rolori ni wala ko sudra ye ten cancer ko den be bra vaccine ke no ka koro den di tanka ile refna di tanka ka boy jangaru junima.
Again, we're very, very lucky in this city that we have free, available resources 7 days a week from 8 a.m. to 10 p.m. that do not, where you are not asked anything about your immigration status, and you're not asked, and you have full privacy so that you can get counseling for yourself and for family to start addressing those emotional needs that we have.
An kuna jalen bale an kuna jalende anye New York leni kuna diaro jonduri ni ile wala kweti bulotila wasiti ni mining kala ile green card kuma iduna America karo jon wala ibrawa wala rojon wala yesila carte jona itana mining kala sima ni wala fi bulote me tu ID mining ka ile carte mi kun sa ID sekila adresse jon long yes la quartier mina o kodo mundi say ya long ile be bulote la kaban ya la sinyo fna be bulote o kumbele wodi.
Yeah, just to finish off this, once we have the pandemic in control, the issues of our mental health and our emotional well-being are the ones that we're going to have to deal with and work with. So you have the numbers here. Mr. Ibrahim will give you the numbers, the text numbers, and the emails so that you can all have this information. It is extremely important to pay attention to these things. They are what we're going to be dealing with for the next few years. And thank you.
Orofana ambebralo ne ya Ibrahima Traore ne Ibrahima Traore itrene wala de ye numéro wala de 844 96 86 93 14 844 863 931 14 yo wele wala ne la numéro ten kana fo an docteur musumtre kumala wolo nyole wala non ye numéro ne wala kana mo si wala an yendi yo ka wala andina baroro wala o betoi ye numéro le wala 844 863 931 4 numéro 4 wala droni ko ke idi kuna friend soro kabantuni idi se ka demena sile rema ka demena se bela delema saka na jensenya ma ka jangaro ninkele e benike eleme ani la men kunyuma anike.
Next slide. I think we're done with our slides. Yes, those are any questions. I just want to thank you. Thank you, Mr. Traore, for your great help tonight. And all of you, please take care of yourself. We have time for some questions, but again, it is very important that you start asking the right questions for yourselves to be able to make that decision, this very important decision for yourselves and your family. Thank you very much.
You're welcome. Uro anye Dr. Flores Estrala. Afu kawali malong pale ka bara buluka kana Andrea kana ni kuna friend bedama kushema ale kala bara le buluka kana nike aisrala le bari washema de srala men matre ni kuro ale brana kanisi kaninya foye ani estrada men fana kani ku beski nyonkan uro amaban folo yi ni kalka kemembulu an ka fo adam naro ikana malya ikana sigan ikana sla an sigilea ini kalka fefe ka gibulu adisi ga bekan ka fiye uro anya ima konona kana malya ikana slang ikana siga ni kalka membulu ni kalka krokolote ikana boy jime foro ku ikona mafo anye docteur Fula anye pela delen Fula aniche
Thank you.
Thank you, Dr. Flores, and thank you, Ibrahima. So we're close to 8:30, so I'm going to ask a pretty popular question that has been coming up lately, which is if there are any long-term effects to getting the vaccine. I think a lot of people are concerned that if they get the vaccine now, then they might have some negative side effects or issues down the line. So I was wondering if you could speak to that.
All right, yes, I'll try to summarize that. People worry about there being long-term effects. As I said before, most vaccines, if they're going to have a bad effect, will have an effect within days or months of being vaccinated, not years. This vaccine has nothing in it or no ability to affect your people when they are pregnant. So pregnant women can take the vaccine without an issue. It doesn't affect them. It protects them and protects the baby. It also protects the baby when when woman's breastfeeding. So those are all things that protect. I'll take a break and then I'll let Ibrahim translate.
Bro, doctor ku side effect taro musu konoma konota bali me ya feka konota mo ko belisa kela ni namra taro bela ate bala usisa ima ba mo shema yin mining kalikela ko especially kelu ko kon kame kuni kake kadi keasa o be mankane di nere na yin kalike sisa Dr. Flores ife ba share ko te tronko di ani na yin kalike Dr. Flores ife ado fana kuna friend ama.
We know.
My personal question is this, because I'm in touch with the community. I do podcasts, and I did that 2 weeks ago. We did another Zoom conversation here. I get this question. First of all, men say, "Oh, I heard if you get the vaccine that you have a problem with your ladies at night."
Okay.
That's one question. The other question, this is very complex. When we first did a conversation, I said 2 or 3 days later, we had this thing that Johnson got rid of some of the vaccine because it's contaminated. And they were asking me, okay, why you were saying on Zoom the other day, and this one, is there a complication? Because when we did the first conversation, we asked them, whoever any question to raise their hand. We did that, we asked that twice, but nobody raised their hand. I said to them, don't be shy, don't be afraid, don't just ask your question. And I told them the other day, come to the Zoom, doctor is gonna be there, and come to the Zoom. But some people are completely shy about, are they gonna be amputated in the bedroom? That's one thing.
Okay.
Also, yeah.
So I was going down the road of fertility. So I will tell you that many parents are worried that if they give their children the vaccine, they're going to have problems having children later. Again, this vaccine doesn't interfere with the reproductive organs at all. It doesn't interfere with DNA. There are no problems with infertility. As far as sexual performance, the one thing that affects sexual performance is COVID-19. Getting COVID-19 has been associated with reduced male potency. not infertility, but potency, the ability to perform. That's the virus itself. The vaccine has absolutely nothing and has had no association with infertility, with impotence, or with lack of sexual ability for either sex. So if you're worried about sexual performance, worry about COVID virus, not the vaccine. The illness can give you impotence. So does that help? That helps, right?
Tia Kafika ka fela la chiala. You can't say ka fosika suro. COVID-19 no sokelila. Jankaro do kila. Ando bekalon jankaro no ki konsoro ka di fela la suro. Koni vaccine no mi de ma utana si toranya sima. Ukorole vaccine tanana fuikla chiaro. Kele atana torla ka dienstron wala ki tro itana khadika kundila temede ma aflama ko aflama ko ka jangarola temede ma ani bonso ima genetic la kadiki ajindo utana setuna ke la vaccine tana ke la fefe udoro sigatamido vaccine ni ayina la tro kende alidi atana banana sima koni lima ke COVID-19 ni kata u bela silima itana sunoko ite sogo iseka daminike ito tana wuli sudo itana seka I wuli sudo kila musola kununya sima wole conductor na wole folani.
And if you're vaccinated, you will not be giving your sexual partner COVID.
Fanani kafo mbara nebra vaccine ta uro muso bona nslani nile ka vaccine ke muso fana vaccine ke nile ma le ka vaccine ke muso ma vaccine ke wa ile bra vaccine ke I chema ke ama bofrode alibi aye wolla uro 5 la be yake uro ni ka ban vaccine ke la ka ban.
I would remind people that vaccinated or no vaccinated, you need to protect against HIV disease. So wearing a condom and taking that protection is still extremely important. So HIV, we need protection for. COVID, we have the vaccine.
Anka jankro do komen ko HIV na ya fala ko sida e koroma.
Sida.
Kuni sida o nima condom dum nima plastic ni dum halibi ire bla la dangerous uroro ye condom ne bla akrenya ma akaile lao makila o nini kon kake musukuli kala musula hali chela kala chela kake musula o sitaro kafone gele dinte geli ni kon kake iduna suboro uroro ye condom dum uro kon nima condom dum sa wodi banala sima ali baname de COVID-19 di wodi bichangoro jura sima le docteur ku ale kon yemen semale men fola be kadoja be ire protéger kabo jangoro ma ni kake musoko kala wala kake che ko kala akala kake che lao kake musolao ye condom do.
Okay.
Yeah.
All right, well, thank you so much, Dr. Flores and Ibrahima, for all of your support for this evening's conversation. And thank you to the Endangered Language Alliance for all of their support throughout this entire series. And yeah, I hope everyone has a wonderful evening.
You are welcome, and thank you, Dr. Flores, for
Thank
this
you.
valuable information to
Yes.
all of us and our listeners. And we are going to spread this in our community. I do my podcast every Thursday. I want to talk about it, and also with my back up the doctor, because we had a doctor in the show who gave us more information.
Very
Also,
good.
there's a phone number you can call, and there's a website called. Well, thank you very much. And the Language Alliance, and we have a great thanks
Evening.
to them also.
Yes.
We had a great evening with you. Thank you very much.
Thank
You're
you.
Good night.
Good
Thank
night.
you. We'll see each other later.
All right, thank you.
Bye-bye.
Bye.